Sydney, the epicentre of Australia's biggest COVID-19 outbreak, is expected to see daily infections rise to a peak of 2,000 cases by next week.
We're likely to reach a peak in cases in the next week or so. That's what the modelling tells us, and therefore a likely peak in intensive care beds required around early to mid-October.
Authorities are trying to speed up vaccinations in order to ease lockdown rules. Now, around 500,000 of 4 million Pfizer vaccine doses have arrived in Sydney as part of a swap deal with Britain. Danielle Robertson joins us live now from Sydney with more. Danielle, 2,000 cases a day by next week. Can the healthcare system cope?
Yeah, well, the State Premier did spend a lot of time today telling the public that we do have enough resources to deal with what is really going to be the biggest crisis that this state has seen since the pandemic began. The number of people in hospital is also going to triple by October, and the Premier says that we do have enough hospital beds to cater for that and enough nursing staff. But other people on the ground have a different story. Paramedics in particular say that the next 2 weeks is going to be a breaking point for them. The paramedics union cited that they have already seen that there have been up to 8-hour wait times for processing COVID patients. They've also seen ambulances line up outside hospitals, and they say that they are already working under pressure with understaffing, and they are already overwhelmed. So the next few weeks are going to be quite anxious. They are anxious about the next few weeks that are coming up for paramedics in particular. While the Premier says we do have enough resources on the ground, how this plays out when we do reach this surge may be another story. But epidemiologists here say that this is, though, going to be the final hurdle before we do reach those freedoms, and that will be once we reach 70 to 80% fully vaccination rates.
And has the economic impact been adjusted, seeing that the lockdown is lasting much longer than previously expected?
Yeah, it is much longer, and there are estimates now that the economic impact to the economy is going to surge past $20 billion, and that's after Sydney is now entering or is in its 11th week of lockdown. The Treasury already estimated that restrictions cost around $1.3 billion every single week, and that was up to July, and that was before the regions shut down. So it is a huge impact to the state's economic wallet. And we'll have to see how long this goes for, but it's a massive impact to one of what is really the economic driving engine of Australia. There are estimates as well that 1 in 5 businesses say that they only have enough cash flow left to last at least 1 month. Other businesses have already laid off workers, and some have closed for good. They have been unable to survive through this lockdown. So it has taken a big toll, and that's what's really pushing this drive for vaccinations, is to try and get some cash flow back into the state. And until we do reach that 70 to 80% vaccination, though, it is going to be an anxious and troubling time.
In Sydney, Danielle Robertson, thank you.